In a hospital, the role of respiratory therapist is always to maintain the airway. So anytime an airway is compromised, they call respiratory therapy.
In an emergency situation, the respiratory therapist is typically at the head of the bed with the doctor. Our specialty is heart and lungs. I joined this program because I knew I wanted to help people.
We are an associate's degree program. We're 2 years, 5 semesters. We prepare students to work with newborns all the way to elderly people. Being able to have a representation of the equipment that they're going to see out there is important. And so they're constantly putting that into practice in the laboratory.
These simulations can generate clinical scenarios that they will have to deal with.
But what's really critical is that they then go to clinicals, to the hospitals.
The second year is where I come in, and that's when they start going to the hospital and examining patients. And if we don't pick up the subtleties of what the patient is showing us, then it makes my job a lot more difficult. They're my eyes and ears.
Prior to graduation, this program actually offers a preceptorship, and you are working with them, shadowing you. I did my preceptorship at UC Davis Medical Center in Sacramento. Not all programs have that.
From the moment they graduate and they earn their license, they get hired and start practicing respiratory care. It has been estimated in California that about 15% of the respiratory workforce is going to be retiring in the next 10 years. Just know that there's going to be a great demand for them.
Going into the field of respiratory therapy doesn't mean that you're only going to be working in the hospital. You could be working at a home, you could be working at a nursing home, you can be working in a very university, high technological field. You could go get your bachelor's degree. You can be an educator. There's many fields in respiratory therapy now that are opening up.
What we do is valuable. The rest of the team is looking for our contribution.
They're a real key stakeholder when I take care of critically ill patients. Doing blood gases, helping with intubation, managing patients on mechanical ventilation, non-invasive ventilation. We get called to patients on the floor that are not doing well.
We do specialize on the breath. We deal with diseases like asthma and kids who are diagnosed with asthma early on, and COPD, educating your patients on diseases that they have, always talking to them, because patients are overall very vulnerable people.
A lot of this information is in their head. Then it goes from the head, it goes to the heart. They begin to realize how important the role is and how important it is to be competent and to be knowledgeable. It's one of the best places where you can make a difference.
Just keep pushing forward, and if this is what you really want to do, the world needs you.